The purpose of the SDE is to bring together the detailed clinical information that can inform high-value research and development or service improvement in healthcare delivery. The challenge that we face in doing that is that the systems that hold that data were not designed with easy, scalable reuse and integration in mind. The way in which this information has been gathered to date is quite often by hand, with research nurses or clinical champions collecting information to answer a particular question. This has been heroic, but doesn't scale very well. How do you pull all of that really detailed information from systems that weren't necessarily designed for that purpose and pull it with such quality and reliability and provenance and context that you can rely on your analysis in terms of making big decisions going forward? We needed to get the governance, we needed to get the architecture, we needed to get the technical solution, and we needed help building it. So where were we going to get that help? We were lucky enough to find Starlight and Telefónica as partners. That enabled us to make this happen in a relatively short period of time. To start with, we needed situational awareness and engagement across the region. Starlight helped us with that.
So the first stage for us was developing an approach for the discovery stage. Now that we fully understood the old system, we were then able to craft what the future solution would look like. Security by default is paramount, obviously because we're holding so much data around patients. So security had to come first. Privacy is another matter, so we needed to ensure that that system was fail-safe. It wasn't just the technology we had to look at, but it was also the people as well. And in terms of that kind of human dimensions of change, that's very important.
So co-production is one of those words that's probably overused and actually misused a lot of the time. And what we meant by embedding this at the very beginning of the way in which the SDE developed was that we really wanted to make sure that we understood and acted on a range of essential perspectives: the people whose data it is, the people who generate the data, the health and care staff that put it into the systems, and those people who are responsible for looking after it, the custodians of the data. We have used the co-design workshops to make sure that we have got public voice in the way in which we organise the committees and decision-making processes in the secure data environment. So, for example, our data access committee has 50% voting members are members of the public, which is more than some of the sort of guidance that we receive, but people were very clear that this ought to be equal. It's not enough just to have a token group of public members.
As well as the strategic engagement, we also had a technical challenge to address, and we needed a partner who had expertise with the right technologies to let us deliver this at scale in a way that's affordable and sustainable. Telefónica Tech fitted that need perfectly. Most importantly, they had the right people who understood what we were trying to do and also how to use, quite frankly, the latest technologies in addressing it.
Telefónica Tech's approach to a project that is as complex as this is to really combine the technical implementation with more of a business change approach. This isn't something that you can simply sort of brute force with a lot of technology. It's something that needs to be implemented in the right way. You can build something that's really good from a technical point of view, but if people aren't really engaged in it and kind of on board with what's going on, then it won't be used and it won't be successful. So we're a Microsoft and Databricks partner, and one of the key things for us was leveraging the best capabilities of the toolset that was available. A big part of what we've done in the technical implementation has been to provide the reassurance to the different organisations and to patients that their data will come in and will be available to the platform. Researchers need the full picture of what's happening for a patient, but they shouldn't know who that patient is. With there being so many organisations who contribute to the data that's within the SDE, each of those organisations is responsible for the data that they hold, and handing that data out to another organisation, albeit another NHS organisation, is something that's heavily controlled. we were able to undertake that integration in a way that provided all of the information governance and assurance and security that meant that as data was moving around, it was still protected, still secure. One of the key things to our approach is that we don't try to do a technical implementation, hand it over and walk away. Ultimately, we're undertaking a project together. And one of the things that I'm sort of most proud of with the project is that we are very much working in tandem with the SDE team. We're jointly developing things. We're seeing them contributing as much to the platform as we are now. And that really, I think, speaks to the success of the project.
As the senior software and data engineer, my role has been to work on the preparation and delivery of data for various types of research projects. In the past, we would end up with projects that we just weren't able to deliver to researchers, and that was due to a variety of blockers, whether that was security, governance or compute. For example, one of our larger projects that's now in the SDE, it was our first project we brought in because from the CDW we realised that we weren't able to build that. The dataset was just too large and our on-prem compute couldn't handle it. On top of that, the governance and security of it, we used to do it that we would be sending the data that we have created and brought together to researchers, and that would mean ensuring a secure transfer method, and nothing would quite fit in terms of ensuring the security of it. Now that we have the new system up and running, researchers can come to us to access that data without having the need to take it to unsecure environments.
This is working. We're able to provide the real-world data to support clinical and translational research and innovation in terms of service delivery in the NHS. This infrastructure is changing the way that we do high-value clinical and translational research in the Thames Valley. And we expect it to be copied across the country. It's a first of its kind, but I think it's the way of the future. It's how to make this high-value R&D work for the NHS and work for its patients.